We don't have the functional machinery. We are fighting situations and also the staffing norms. We actually come up and we when you look at the budget, whatever comes up, it comes in time. The government provides so much by monthly supply of drugs and all these other test kits and whatnot. And you know what is happening right there? Whatever they apply, whatever they supply on the ground to work for 60 days, it is exhausted within 11 days. That tells
that should be the short. We go to the main
as I
debate.
conclude, right, Honourable Speaker.
Honourable Speaker, I want to thank the Honourable
ensure that on the ground
for raising this issue yesterday, but also thank the
Honourable
Minister
we should ensure also
responded
that the facilities which we have upgraded and we don't have the functional machinery within and also the staffing norms, we actually come up and we put the staffs there and also the machineries within those facilities. Thank you so much, Honourable Speaker.
The medical doctors are
on the 19th and the 20th of June, that is last month, we had a very big camp, health camp, that was run by Caring Hands International Ministries. Thank you very much, Right Honourable 73 medical personality from I want to thank being led by the team from Mulago.
The shadow health should prepare, yes, and that should be the end. We go to the main debate,
I want to thank Right Honourable Speaker. I want to thank the Honourable Andrew Kaluya, which should also be of for raising this issue yesterday, but also thank the Honourable Minister that who has 47% of the people they tested had non-communicable diseases raised. So that means, Speaker, as we are looking at malaria as one of the key killers, as it has been known in the past, we are also facing other challenges that are now eating our community slowly but surely. On the 19th and the 20th of June, they emphasized that is last month, diabetes. We had a very big camp, health camp, among others. That was run by Caring Hands International. I want to request the Minister here and all of us as Parliament that up to now we have sub-counties across the country, in our communities, in our constituencies, that don't have health center things. So I want to request the Honourable Minister, as you bring in your work plans, which we manage here as Parliament, let's bridge that gap of all sub-counties in the country that don't have health centers in order to take services closer to our people. Over 1,000 tests they ran.
The Minister
they did
wants
not
to
realize
respond
in the malaria case.
Yeah.
I want to thank government.
The Shadow Minister will come, but you see, let the Minister answer a little bit, because he will give you the clarification. Yeah.
Okay, thank you very much, Right Honourable Speaker, and honourable members, for the interest you have in matters of health, because they touch all of us and our constituents. I just wanted to make two comments, Right Honourable Speaker. The Minister of Health, I pledge to give you as much information as possible regarding what we are doing to address the challenge of health care in this country. And I will request you, Right Honourable Speaker, if the order paper permits, for tomorrow, I update members of Parliament on the Ebola outbreak, how far we have gone in the country.
Immediately? Yeah. The Shadow Minister will come, but you see, let the Minister answer a little bit, because
I want to request that I want to work with your office.
He will give you the clarification.
That we get a day or two. Okay, thank you very much, Right Honourable Speaker, for members of Parliament and honourable members. I bring all my technical team from the ministry, and then we update you on what the ministry is and our constituents. I just wanted to make two comments to address the disease burden in this country. That as a Minister of Health, I pledge to give you as much information as possible regarding what we are doing, the cancer, the Heart Institute, the challenge of health, the plans we have to upgrade health centers, and I will request how many sub-counties do we have that do not have health centers? If the order paper permits, tomorrow How are we planning to provide the ambulances on the border constituencies which do not have? How far we have now we can't exhaust that debate in a sitting if they order because of the time limitation. So I beg that I work with your office. You give us time, we do a workshop, and then we bring all the Ministry of Health. The honorable members have many questions and give you the answers. So that as we start this term, you know what government is planning many members of parliament to address the health challenges in our constituencies.
Okay.
I take
Honorable Naruyima,
I want to request that I want to work with
you
your
are speaking
office,
for the
Right Honorable Speaker, that we get a day or two
all these
and we do a workshop for members of parliament.
area I represent.
I bring on my technical team from the ministry.
Thank you, Mr. Speaker.
And then we
first of all,
update you
I would like
on what the
to
ministry is
correct our
doing
data as Parliament.
to address the
school
disease
is
burden in this
Mweraze
country.
High School in
The
Kachiri.
communicable diseases,
and it's found in
non-communicable
Wakiso
diseases,
district.
neglected
And
tropical
also,
illnesses. That's what I will
Just
allow you.
to add on, the matter you
The
hinted on
cancer,
the matter
the Heart
of
Institute,
Naria
what's
assessing
doing,
where you get it.
the plans we
That
have to
also
upgrade
had
health
a
centers,
suicidal
how many
death.
sub-counties do
Since
we
Mr.
have that do
Speaker,
not have
our
health
honorable
centers
minister has asked
and
for
what
time.
plans do
I
we
only
have?
pray that as it
How are
comes
we
on,
planning
as
to
we get
provide the
that
ambulances
very
to
workshop,
constituencies
we also
which do not
start
have?
right now to handle
Because
the
now
matter,
we can't
the
exhaust
matter
that
of mental
debate
health
in a sitting
schools because it's
because of the
something
time limitation.
they are living
So I
out
beg that
somehow,
I work
and
with your
it's
office.
affecting many of our
You
children.
give us time,
Our
we do a
children are
workshop,
overloaded,
and then
they are
we
reading hard, they are
bring
doing a
all the
lot.
Ministry
So
of
the
Health
Ministry of Health and
technocrats,
Education, they
and
work
then we engage and
they have
give
to work
you the
together to see
answers
that we have those
so that as
counseling
we start this
services
term,
and the children
you know
are
what
handled
government
well.
is
I thank you
planning
so much.
to address the health
yes,
challenges.
mental
in our
health is a serious
I
concern.
take it
Honorable
like
Honorable
Naruyima
Ministers of Health and Education, you are speaking for you will need to formulate. Honorable Minister of
Speaker.
Education, you have something? Then General Kavuma, you come and we.
I represent.
Oh, there is a traditional healer here.
Mr. Speaker,
We
thank
shall
you, Mr.
conclude with.
Speaker. First
Right
of all,
Honourable Speaker,
I would like we correct
first of all,
our
I thank
data
the
as
MP
Parliament.
of Wakiso.
The school is Mweraze
As
High
a sector
School
of
in
education,
Kachiri,
we have been
and it's
issuing
found in Wakiso
circulars
district.
and we have
And
communicated to almost
just
all
to
schools
add
in the
on,
country.
matter-
There's
you
one
hinted on
biggest
the matter
challenge which now
of
goes to
Naria
us, the
SS
parents.
in where you get it. That
And this
also
is where we need your
had a
indulgence.
suicidal death.
Some of us
Since
are
Mr.
part
Speaker,
and parcel
our
of the
honourable minister
problem
has asked for time.
affecting
I
our
only
children.
pray that as it comes on, as
A
we
case in
get
point
that
is where
very workshop,
you
he
go
also
for
starts right
visitation
now to handle the matter
with a
of mental
helicopter,
health
particularly
in
you
schools
give your
because it's
kid
something
an
they are
helicopter
living out
to go to
somehow,
school.
and it's affecting many of our children. Our children are
I'm
overloaded.
speaking as a
they
minister
are
of the
reading hard,
sector.
they are doing a lot.
Secondly,
So the
some
Ministry
of you
Health and
go,
Education, they
because
work-
it's a birthday
they have
of
to
your
work together
kid,
to see that we
you
have
go
those
and
counseling
splash
services
money,
and the
throwing
children are
it
handled well.
before
I thank you
other
so much.
children.
Yes,
Friends,
mental health is a serious
What
concern.
happens to others
Honourable
who do not
Ministers
have
of
access
Health and
to this kind
Education,
of money?
You will need to
And tomorrow
formulate
you are the
that.
same person
Honourable Minister
who
of
denies
Education, you
that
have
kid
something? Then
the
General
same
Kavuma,
money,
you
and yet
come
the
and,
kid, you've made that kid get used to
There
this
is a
money.
traditional healer here.
So I want really to appeal to all of us. We all,
Right,
we are
Honourable
all
Speaker,
stakeholders
first
regarding
of all, I
matters of
thank the
education.
MP of
And it is
Wakiso.
our responsibility to
As
get
a
out
sector of
and talk to our
education,
people,
we have been
talk to our
issuing
constituents,
circulars
to behave in
and we
line
have
with the
communicated
guidelines we have
to
issued.
almost
Let
all
me speaker,
schools in the
I will be
country.
able
There is
to
one
lay on
biggest
table
challenge which
the
now goes to
circular
us, the
guidelines we have
parents.
issued at the Ministry of Education and Sport
this is where we
to
need your
all
indulgence.
districts,
Some of us
schools
are part and
across the
parcel of the
country, because
problem
we did it in the
affecting
last
our
parliament.
children.
I can again be able to issue
case in
so
point
that we
is
get
where
out. But I welcome the
you go
initiative
for
of saying
visitation
we get out and talk about
with a
mental
helicopter,
health. But it's our
particularly give your
responsibility
kid
as members
an
of parliament. I
helicopter
thank you so
to go to
much.
school.
General Kavuma. Honourable General
I'm
Kavuma.
speaking as a minister of the sector.
Give the military.
Secondly, some of you go, because it's a birthday of your kid, you go and splash money,
you very much.
throwing it before
Right,
other
Honourable
children.
Speaker, for giving me this
Friends,
opportunity.
what
Let
happens
me,
to others
if I make
who do not have
my
access
submission,
to this kind of money?
those
And tomorrow you are the same person who denies that kid the same money, and yet the kid, you've made that
being a
kid
speaker
get used to
of
this
the
money.
People's Parliament. Congratulations.
I want really to appeal to all of us. We
on
all,
the
we are all
matter, I'm not a
stakeholders
doctor,
regarding matters of
leader,
education.
parent.
And it is our responsibility to get out and talk to our people, talk to our constituents, to behave in line with the guidelines we have issued. Right, Honourable Speaker, I will be able to lay on table the circular guidelines we have issued at the Ministry of Education and Sports to all districts, schools across the country. Because we did it in the last parliament, I can again be able to issue it so that
Why in Uganda? And my research revealed two main issues. Number one, Right Honorable Speaker, is that 98% of do not go for periodic and regular medical checkups. That is a fact. We live on self, medication. You get headache, you go to the nearest pharmacy. The pharmacist prescribes some drugs, you go home. When the pain reduces, you don't even finish that drug they gave you. That's why you see every 2 kilometers there is a new pharmacy, because pharmacies make a lot of money out of us, or drug shops. And if you check, for us who are here, if you reflect what is in your bedroom, you find all of us having many pharmacies in our bedrooms and houses because of self-medication. Now, that is a problem to all of us. But number two, Right Honorable Speaker, is even the 2% that try to find out how they are, to check regularly, do not get the correct diagnosis. That is also another huge problem. Famous hospitals in Kampala here. You go to Murago, they'll take your blood and whatever, they'll give you results. If you go to Nakasero and test for the same, different results. If you go to IHK, they give different results. Now, where is the problem? You have issues, they say it is pneumonia, mild pneumonia. They give you a sack of antibiotics. You finish them, the pain comes back. You go to another hospital, it is ulcers. They give you another sack of antibiotics. You finish them, the pain comes back. You go to another hospital. It is... Now, those, Right Honorable Speaker, those who afford, when they go to our neighbor here in Aga Khan, which takes only 50 minutes from here, they check you, they find you have cancer and it is at stage 4. So my question is, where is it the machines? Where do we buy these machines? Is it the people that read the outcome of the machines? Where is the problem? So my prayers are, Right Honorable Speaker, my 2 prayers is, we are leaders, you are here as a house, you represent people. Please go back and sensitize and mobilize your people, the people you lead, the people that elected you to come here, to go for regular and periodic medical checkup. Number 2 prayer is the Minister of Education should look at the diagnosis issue. Where is the challenge? I beg to submit.
Yes, traditional healer. Honorable Minister, note down, because the Shadow Minister of Health is going to give some statement, and you'll wrap it up. The traditional healer is doing well. Honorable Lino.
Thank you, Right Honorable Speaker. Mine is just a suggestion. In our secondary schools, primary schools, boarding, these schools majorly have sick bays with a nurse, but they do not have laboratory technologists, because most of the time when kids are sick or children are sick, the nurse just assumes. So I want to suggest to Ministry of Education and Health, if they can come up with a policy insisting that schools must recruit a lab technologist, and the schools should buy simple microscope to at least carry out some tests, because diagnosis is the most important thing. It helps you to understand and know what disease a child is suffering from. So I would request the Minister of Education and the Health to come up with a policy so that all our secondary boarding schools have at least simple laboratories. Thank you.
You must take that recommendation from a traditional healer very seriously. Because they have tried to do guesswork, they have seen more people dying. Honorable Aisha. Yes? And then shadow minister, and then the real minister closes.
Thank you so much.
I don't know who started the issue of shadow and what. Yeah.
Thank you so much, Mr. Speaker. I want to thank the previous speakers. First of all, I need to clarify that the prevalence is no longer 10%. Those are statistics of 2019. And it has actually increased. And many of these malaria cases are actually in schools, secondary schools, primary schools. And like my colleague has mentioned, the treatment method, that's where the problem is. They give them Panadol, headache Panadol alone. And finally, I also wanted to add that unfortunately, blood group O positive are also very prone to mosquito bites and malaria. Thank you so much.
Shadow Minister of Health.
Thank you, Right Honorable Speaker.
2 minutes. By the way, you are too generous with time. We have the next time that, yeah.
Yes, thank you, Right Honorable Speaker. And I'm making a submission on behalf of while we appreciate the Minister's report, we must confront this malaria problem with green. Uganda remains trapped in a preventable crisis. Right Honorable Speaker, the Minister speaks, Dr. Beremusi, you speak of progress, but the Uganda Malaria Indicator Survey reveals a terrifying policy failure. The national prevalence has actually risen from 10% to 13%. In regions like Lango, Acholi, Karamoja, childhood infection rates are at a high as 60%. This is not progress. This is a national emergency. As Shadow Minister, we request and demand for an immediate policy reversal from passive malaria control to an aggressive elimination agenda. First, we must stop distribution of the obsolete standard pyrethroid nets that mosquitoes are now laughing at. The government must fully pivot to dual insecticide next generation nets like chlorophyra treated nets, which have been proven by World Health Organization to slash transmission by 50%. Secondly, Honorable Minister, we request to institutionalize a mandatory indoor residual spraying, that is IRS, in public facilities, specifically boarding schools, to protect our children where they are most vulnerable. Finally, Right Honorable Speaker, we cannot eradicate malaria on a beggar's budget. We demand a shift from total dependency on foreign donors to dedicated domestic health financing. We must equip our village health teams and end the chronic fetal medicine stockouts in our health centers, and this is happening to all of us in our areas of jurisdiction. Right Honorable Speaker, we must stop managing malaria and start killing it. I beg to submit.
Thank you. There's somebody here who said he has one minute or 1 minute.
Right Honorable Speaker.
A lawyer speaking about vector in 1 minute.
Yes, Right Honorable Speaker. I join my fellow members in congratulating you to that honorable seat. And I also want to thank my honorable brother for that great statement. Now, we have been talking about the parasite, But I understand that we can also look at the flip side of this coin, which is the vector. I understand there's a new vector in Uganda, which would probably in the future cause more difficulty in terms of fighting malaria, especially relating to the malaria tool. It bites during the day. That means bed nets will not work. It breeds during the dry season. That means the incidence of malaria during the dry season, which are normally low, will still be at a height. So these are some things that I would want to relate with my Honorable Minister to look not just at the parasite site, but at the vector. I think it's called phenastas. And I think the type of malaria tools that we're using right now will become obsolete. There's drug resistance, there's insecticide resistance. Malaria is the single biggest killer in Uganda. If Uganda does not, population will be exposed to a lot of difficulties. So that was the issue I just wanted to raise with my Honorable Minister.
Thank
you.
you. Honorable Minister of Health. What is the summation?
Thank you very much, Right Honorable Speaker. I have the capacity to give a technical response to the issues being raised, but I have a limitation of time. So that's being raised, but I have a limitation of time. So that's why I requested that you provide last time we do a workshop and be able to delve into details of what the honorable members are raising, including examining the policy on malaria, like my sister from Mukono is saying, is there a policy failure or not? All those issues, we can interrogate them when we have time. But the good thing, she's quoting from reports from government, all that information. But it's not true that the policy on malaria has failed per se. But we shall provide all those, but other challenges which affect our children. The Minister of Education was reminding me that when the children are reporting for a new term, there is a form on their heads which is supposed to be filled. But most parents ignore it. I think we shall keep reminding Uganda that they should fill it so that the school managers know the health concerns of this learner and they be able to attend to that learner. Finally, Right Honorable Speaker, maybe part of the response to the issues raised by Honorable Kavuma. The disease burden in Uganda, that will be very brief, is characterized by what we call communicable diseases. These are diseases which can be transmitted from one person to another, like malaria, HIV, diarrhea, Ebola, all these. But also non-communicable diseases. And we see a rise in both communicable and, most importantly, the non-communicable diseases. But also we have the neglected tropical diseases. Just 1 minute, I first finish my point. And we shall discuss with you the approaches and the reforms which we are instituting in the health sector to address this burden of disease. I can tell you that up to 70% of the diseases which afflict Ugandans are preventable. And we are going to mount a huge response on disease prevention and health promotion in the country. Straight from the center to our villages, we shall be giving you the strategies, but also strengthen clinical management of the diseases, including rehabilitation and the palliative care. That's why you see us working day and night, visiting hospitals. And we are going to do both formal and informal visits to our hospitals to assess what is obtaining on the ground and be able to come up with reforms and strategies to improve health care in this country. So the assurance I am giving you is that we shall do everything possible. We need your support as Parliament to fix the health issues in this country because they affect all of us. Honorable Sewungu is dying with the point.
No, Honorable Sewungu is a traditional healer.
Healer.
Please, let's go to another. Yeah.
Maybe my response on malaria, what I didn't talk of is that we have now a malaria vaccine, which we are rolling out also among young people, including schools. And we shall discuss all these when we meet in the dialogue. Yes. Please.
Okay.
So now, thank you very much.
Thank you very much. And
I get to submit.
The people of Kanungo, now you know what you brought us. He's a very well-informed man. When you say, in Kanungo, you say the man is eating, but you see they are firing him things here. So, thank you very much. Clerk, next item.
Item 4. Motion for a resolution of Parliament to express gratitude to His Excellency the President of the Republic of Uganda, Yoweri Kaguta Museveni, for the clear and precise exposition of government policy contained in the State of the Nation Address to Parliament of Uganda on 4th June 2026.
And this is how we are going to proceed. Uninterrupted 3 minutes. I will begin with the following. Number 1, Honorable Engineer Bigamba Kutbat, Chibale County. Honorable Bruce Balaba Kabasa. Honorable Rugumayo Edison. And Honorable Ofono Pondo, older persons. This on this side. On this side, you listen. We shall have Honorable Bisaso Abdul, Kasanda South. We shall have Honorable Kaluya Andrew of Uganda. I don't know whether Uganda or town or what. Chigulu North. Then we shall have Honorable Kutesa Patrick, MP Chimanya Kabonera. And then we shall have Honorable Auma Janet. So we shall go, you don't need to stand up unless I ask you to. Please, the debate issues now. No further guidance. No interruption. Where Engineer Katubat is not there, the next person. Honorable Bruce Balaba. Is he there? Yes. This is a structured way of debating.
Right Honorable, thank you so much. My name is Wakoli. I'm just seeking a clarification from your communication.
But how do
we actually do not know how you have arrived at the names, and I'm wondering how we are going, because you guided ably that this is not a matter of national importance, and we thought that as your members were going to stand and pay tribute to the State of the Nation address. I'm just seeking, yes, Right Honorable.
Now you are quarreling.
I'm not.
A person who quarrels is the one who does not ask permission to speak. When permission is given to you, then you are debating. So there is a formality here. I want to dispose of what I have here, but then I will go back to those that may not have accessed the table, the offices. The whips are giving names to the chairpersons, to the speaker's office. So, Honorable Balaba, 3 minutes, uninterrupted.
Thank you very much, Mr. Speaker. My name is Bruce Baraba Kabasa, Member of Parliament for Uganda County West. Mr. Speaker, I want to join the members who have spoken before in the previous days in thanking the President of Uganda for being clear in his statement to the country in the State of Nation Address. Mr. Speaker, the President said many things, but he emphasized what he called the word. And Mr. Speaker, the President did indicate that without resources, he mobilized the people in the cattle corridor to engage in transformation from pastoralism to settlements, and eventually to what we are seeing today as production and modernization of that community. Mr. Speaker, I want to relate this to what is happening in our country. In our country today, unlike when the president was engaged in the word, today there is an infrastructure. At the time he gave the word, there was no infrastructure for the civil service and the establishment. Today, we have a robust local government structure. We have civil servants at the parish and sub-county level, and we have members of parliament and councillors elected by the people of Uganda. The problem at hand, Mr. Speaker, is that the government of Uganda has not established a legal framework that coordinates the work of members of parliament, the work of councillors, together with the work of the technical people. As we speak now, Mr. Speaker, there are roads which are being launched in the country. There are hospitals which are being opened, health centers being opened across the country. And members of parliament are here. Structure of the word that the NRM has established, especially after the introduction of UPE, is today disjointed. And in the process of disjointing this infrastructure, it becomes very difficult, Mr. Speaker, for the elected leaders and the local leaders to harmonize in the process of service delivery. Mr. Speaker, in very addition to what the President spoke about, it is important today that the government of Uganda, in implementing the address of the President, works out an organized structure where members of parliament individually, without...
Next. Honorable Rugumayo, are you there? Honorable Fonopondo? Or I should pronounce it well. Honorable Rugumayo Edison, the MP in Toroko County.
Thank you, Right Honorable Speaker. First of all, I want to congratulate you, Right Honorable Speaker, and all members of Parliament upon our inauguration to the 12th Parliament. Honorable Speaker, I rise to applaud the President for his well-articulated and inspiring State of the Nation address. Honorable Speaker, the President delivered his message in his characteristic, very free and yet profound. He fixed himself within the story, generously sharing with